meeting here.
Ready? All right, good afternoon, everyone. Happy Monday. Today and every day for the past few weeks, thousands of city employees have been on the front line of the pandemic here in Philadelphia. Police, fire, health, streets, and the Department of Behavioral Health and Intellectual Disability Services, DHS, the Office of Information Technology, License and Inspection, and many other departments have been working to ensure that core city services continue uninterrupted. And at the same time, they're working to help our medical facilities get prepared for what could be a surge in cases. As you may know, the current contracts with our 4 municipal worker unions expire at the end of June. In light of that deadline, and in the midst of this health crisis, we began discussions last week with all 4 unions on a 1-year extension of their contract. We did this now so our employees could focus on the health crisis at hand rather than months of contract negotiations. I'm pleased to announce that last night we signed a 1-year extension with the FOP Lodge Number 5, and discussions continue with the other 3 unions. The FOP extension includes a 2.5% raise for the police department, 2.25% raise for the sheriff's office, and a 2% raise for the Register of Wills, effective May 1st. Under this extension, allegations of harassment or discrimination will be investigated by the Employees Relations Unit of the Office of Labor Relations rather than by the police department themselves. And we are still committed to seeking discipline and other operational reforms in a new long-term contract that will be negotiated this time next year. I thank John McNesby and the leadership of the FOP for their willingness to tackle this and to do so in such a short period of time. And I'm confident that we'll also be able to reach agreement on similar 1-year extensions with the leadership of Local 22, District Council 33, and District Council 47. It won't come as a surprise to anyone to learn that I'm a big supporter of early childhood education. It's one of the best investments we can make in our kids and their families and in our education system over the long term. Collaboration among government, philanthropy, nonprofit organizations, and small businesses has helped Philadelphia make great progress to improve access to high-quality early learning. Today, 10,000 more children have access to high-quality early learning each year than they did just 5 years ago. Like any small business, many of these early childhood programs are now threatened by the economic downturn brought on by the coronavirus. Because many providers are not collecting tuition payments or co-pays while centers are closed, they are losing revenue they rely on to stay open. These programs need to be here for our families and children when this crisis is over. These programs make it possible for parents to go to work while their children learn important skills that prepare them for kindergarten and beyond. So I'm extremely pleased to share that the William Penn Foundation and Vanguard have partnered to provide support and leadership to ensure that our youngest children will have access to high-quality early learning when the period of closure ends. In collaboration with the Reinvestment Fund, they have just launched the Philadelphia Emergency Fund for Stabilization of Early Education, a $5 million grant from the William Penn Foundation and a $2 million grant from the Vanguard Strong Starts for Kids program will launch this effort. It will provide emergency funding to early learning providers struggling to keep their staff members employed and keep up with expenses such as rent and other emerging needs. For more information, please visit reinvestment.com/PEFSEE. That's reinvestment.com/PEFSEE. We're grateful for the support that William Penn and Vanguard have shown to support early learning in years past, and now during this time of crisis especially. I particularly want to thank Janet Haas, and she's been just phenomenal, the chair of the board of the William Penn Foundation, and Kara Kotiaka, president of Vanguard Group Foundation and executive director of community stewardship for Vanguard, for their leadership in this initiative. Foundations, corporations, and individuals are encouraged to provide additional support so these programs can help our youngest children learn again and learn again soon. I'm also very pleased to announce that Josh Harris and David Blitzer of the Philadelphia 76ers organization are committing significant resources to help our city during this time of need. This morning, they made an incredibly generous donation to Philabundance, which will provide 20,000 boxes of food that will feed 160,000 people across the Philadelphia area. And I'm pleased to announce that Josh and David and the Sixers are committing the funds needed to purchase 10,000 Chromebooks for students in the Philadelphia School District. I'm told this is just the start of what the Sixers will be doing to help our city and its residents in this critical time of need. I thank Josh, David, and the entire Sixers organization for their tremendous commitment and for being leaders in our community. Today, I also have to share some updates from the Department of Commerce and PIDC on the Philadelphia COVID-19 Small Business Relief Fund. All applications received by 5 p.m. today will be reviewed for funding consideration. However, after 5 p.m., applications will only be accepted and reviewed from businesses applying for the Microenterprise Grants of $5,000. Applications for Tiers 2 and 3 of the program, the Small Business Grants and zero-interest loans, will no longer be accepted or reviewed after 5 p.m. today. Philadelphia's businesses have been severely impacted by the COVID-19 crisis, and that is evidenced by the overwhelming demand for this program. We will make decisions quickly to support as many businesses as we can who need assistance now in order to preserve jobs. At the same time, we're also working to identify additional local funds and connect our businesses to resources from the state and federal governments that can meet needs on such a greater scale. Again, I think we're entering week 4, if I'm not mistaken, of this. We're plugging along, doing our best to keep ahead of everything. And I want to thank all involved, all our employees, and all the leaders of our departments for continuing their great efforts in this regard. And speaking of one of our great leaders, I'd like to bring up Dr. Farley.
Thank you, Mayor. Just going to give you a brief update on where we are with the health situation in Philadelphia. Our posture is very similar to what it was last week, with a continued growth in cases of the coronavirus infection in Philadelphia, with the testing available in the city, but somewhat limited, and our healthcare system preparing for a surge in cases, but currently widely available for anyone who needs it. So some specifics here. Since yesterday, we've had 182 new cases of coronavirus infection reported in Philadelphia residents, bringing us to a total of 1,072. That 182 is an increase from what we saw daily last week and over the weekend, but a couple of key laboratories were not reporting data over the weekend, so some of that is just reflecting the backlog from over the weekend. Details on the 1,072 patients. We know that 79 were known to be hospitalized. Now, I've reported that number each day when we've had press conferences here, but because our information is limited, we know that that's the minimum number of people who are hospitalized. We hope to, in the future, be getting better data, and so we'll have a more accurate number of the total number of people who are hospitalized with this infection. Of the 1,072, 74 were known to be healthcare workers. We now have cases in every zip code in the city of Philadelphia. We posted a map on our website late on Friday. We've improved that, what that map is now showing. It now shows for each zip code the number of positives and the number of tests within that zip code. And if you look at it, it's entirely clear that this virus is everywhere in the city. A little bit about the racial composition of people with this infection. Most of our data has missing information on race. We don't know the race of the people who have positive tests. However, we do have information on about 15%, and we have noticed in the past couple of days with very small numbers what appears to be a shift where we're predominantly Caucasians who were infected before. We now are seeing more of a predominance of African Americans. The numbers are very small, so I wouldn't take anything too seriously about the specific numbers. But what this does do is just emphasize again that this virus does not discriminate. The virus is in every neighborhood, it's in every population. Everyone needs to take our recommendations seriously to avoid getting the infection or passing on the infection. We have one new coronavirus-related death in the city to report today. This brings us to a total of 9. This death was a female in her 80s who had an underlying medical condition. Of the 9 deaths that we're reporting so far total, 5 of those deaths were occurring in people residing in nursing homes. So that drives home the point that the nursing home population is particularly vulnerable. We're taking a number of steps to protect that nursing home population. We're going to continue to do that. A little bit about testing. The hospitals are still providing testing in the city. There are 16 sites in the greater Philadelphia area, testing about 1,000 people per day. These are, for the most part, by referral, so you need to contact the health system that is operating the site. In general, they're testing people who are healthcare workers or who are over the age of 50 who have symptoms. We have testing that we are providing through a partnership with state and federal agencies at Citizens Bank Park. It is open today from 1 p.m. to 6 p.m. Yesterday, we tested 142 people. We'll continue to have it open 1 to 6 p.m. every day, weather permitting. Our criteria at that site are what I said earlier: healthcare worker with symptoms or a person over the age of 50 with symptoms. Just to remind everybody again what you need to do to stay safe. If it's not essential for you to be outside for work, or if you're not going outside just for some quick exercise, stay home. If you do have to go out, keep your distance from people. And after you touch things, wash your hands so that if you got the virus on your hands, you can wash that off. If you develop fever and respiratory symptoms, it's particularly important that you stay away from others. If you have to go out, wear a mask. And if you have these symptoms and you're staying at home, these are the symptoms to look out for that you might need to go, that you should go in for medical care if you have them. Difficulty breathing, pain or pressure in the chest, or confusion, or if someone with you you have difficulty arousing them, or a bluish look to the lips and face. The hospitals in Philadelphia are very much attuned to this. They have opened up space so that they're available for health care, to provide health care if we do have a surge in demand for health care. Right now, the number of people seen in emergency departments is less than usual, so emergency department care is available for anyone who has those symptoms who needs emergency care. More information on what to do about this crisis is at our website, www.phila.gov/COVID, COVID, where medical questions can be answered at 1-800-722-7112. Thanks very much. And with that, now I want to turn this over to our Spanish interpreter, who's going to give a synopsis of the mayor's comments and my comments. His name is Armando Esquerra Hasbun. Thank you.
Buenas tardes. Miles de empleados de la ciudad de Filadelfia se encuentran en las trincheras combatiendo esta pandemia. La policía, los bomberos, el Departamento de Salud, la Oficina de Tecnología Informática y muchos otros han estado tratando de trabajar para garantizar que los servicios esenciales de la ciudad continúen sin interrupciones. Paralelamente, estos departamentos están trabajando para asegurarse que las instalaciones médicas estén listas para un potencial repunte y aumento repentino de los casos. Como sabrán, los contratos actuales con los 4 sindicatos de trabajadores municipales vencen a fines de junio. Por tanto, en medio de esta crisis sanitaria y en vista de este plazo, la semana pasada se iniciaron conversaciones con los 4 sindicatos sobre una extensión de 1 año en su contrato. La ciudad de Filadelfia anuncia que anoche se firmó una extensión de 1 año con el FOP Lodge 5, es decir, The Fraternal Order of Police o el Sindicato Policial número 5, y las negociaciones continúan aún con los otros 3 sindicatos. La extensión del Fraternal Order of Police incluye un aumento del 2,5% para el Departamento de Policía, 2,25% para la Oficina del Alguacil y el 2% para el Register of Wills a partir del 1 de mayo. Confiamos en que también podemos llegar a un acuerdo sobre extensiones similares de 1 año con los líderes de los sindicatos Local 22, DC 33 y DC 47. En otros temas, la ciudad está comprometida a que nuestros niños tengan acceso a educación temprana desde su más temprana edad. La colaboración entre el gobierno, los filántropos, las organizaciones sin fines de lucro y las pequeñas empresas han ayudado a que Filadelfia logre grandes avances para mejorar el acceso a la educación temprana de los niños más pequeños. Como toda empresa pequeña, muchos de estos programas para la primera infancia se ven ahora amenazados por la crisis económica provocada por el coronavirus. Estos programas deben estar aquí para los niños y las familias cuando termine esta crisis. Para ello, la ciudad de Filadelfia se complace en anunciar que la William Penn Foundation en Vanguard se nos ha unido para brindar apoyo y liderazgo para asegurar que los niños más pequeños tengan acceso a una educación temprana de alta calidad cuando acabe el cierre temporal de las escuelas. En colaboración con el Reinvestment Fund, se anuncia la creación de un fondo de emergencia de Filadelfia para la estabilización de la educación temprana. Una subvención de $5 millones del William Penn Foundation y una subvención de $2 millones del programa Vanguard Strong Start for Kids respaldarán esta iniciativa. El Fondo de Emergencia de Filadelfia para la estabilización de la educación temprana proporcionará fondos de emergencia para los proveedores de educación temprana que luchan por mantener la nómina de sus empleados y para mantenerse al día con los gastos operativos como el alquiler y otras necesidades emergentes. Hoy también compartimos algunas actualizaciones del Departamento de Comercio, el PIDC, sobre el Fondo de Ayuda COVID-19 para las pequeñas empresas. Todas las solicitudes recibidas hasta las 5 de la tarde del día de hoy serán revisadas. Sin embargo, después de las 5 de la tarde, las solicitudes no serán aceptadas para las microempresas que reciban hasta $5,000. Las solicitudes para los niveles 2 y 3 del programa, las subvenciones para pequeñas empresas y los préstamos sin interés no serán aceptadas ni revisadas después de las 5 de la tarde del día de hoy. La ciudad de Filadelfia está trabajando para identificar fondos locales adicionales y para conectar a los negocios con recursos del gobierno estatal y federal que puedan satisfacer sus necesidades en una mayor escala. En relación a la última información disponible en materia de salud con respecto a la COVID-19 en Filadelfia, se reporta de que hay un aumento continuo de los casos. La tendencia, lamentablemente, es que sigan aumentando rápidamente. El sistema de atención médica está disponible, sin embargo, para todos aquellos que lo necesiten, independientemente del idioma que hablen, si tienen seguro médico o no, o de su estatus migratorio. Desde ayer a la 1 de la tarde se han confirmado 182 nuevos casos del coronavirus en Filadelfia y actualmente tenemos 1,072 casos confirmados. Los detalles que podemos proporcionar son los siguientes. Hay 79 personas hospitalizadas. De esas, 74 son trabajadores del sector de la sanidad. Hay casos que se reportan en toda la ciudad. En el sitio web phila.gov/COVID-19 se podrá encontrar un mapa donde puede ubicar el código postal, así también como el número de pruebas que se han realizado. Sobre la raza, aproximadamente el 85% de los informes no incluyen este dato, pero por datos anecdóticos que se conocen, se ha evidenciado un repunte en las comunidades afroamericanas. Es importante destacar que este virus no discrimina ni por raza ni por género. Reportamos también un nuevo fallecimiento en Filadelfia. Se trata de una mujer de unos 80 años de edad que presentaba condiciones médicas preexistentes. En total, han fallecido ya 9 personas. 5 de esas personas han fallecido en hogares de ancianos. Las pruebas se encuentran disponibles en la mayoría de los hospitales, pero deben ser ordenadas por su médico primario o médico de cabecera. Las pruebas se pueden aplicar a personas que tienen síntomas, que son trabajadores de la salud o que tienen más de 50 años. Sobre el centro de pruebas en el Citizens Bank Park, les recuerdo que hoy está abierto de 1 a 6 de la tarde y el día de ayer se realizaron pruebas a 142 personas. Los casos van en aumento. Todos tenemos que aportar nuestro esfuerzo para permanecer sanos. Si usted no es un empleado esencial, por favor, quédese en casa. Si debe salir a trabajar, le recomendamos que mantenga la distancia social de 6 pies y lavarse las manos continuamente. Si está enfermo con fiebre o tiene problemas respiratorios, por favor, manténgase lejos de otras personas. Si debe salir por una emergencia, por favor, póngase una máscara. Si presenta los siguientes síntomas, debe buscar atención médica de forma inmediata. Problemas al respirar, dolor fuerte o presión en el pecho, confusión o dificultad para despertar, labios o caras que se tornen azules. Nosotros estamos preparados para atender y responder a esta emergencia médica. Le invitamos a consultar el sitio web para mayor información www.fila.gov/COVID. Recuerde que puede llamar usted al número 311 si tiene preguntas sobre la COVID-19. Tenemos servicios de traducción disponibles en 100 idiomas. Las respuestas a sus preguntas médicas las 24 horas del día, las 7 días de la semana se puede hacer llamando gratis al número 1-800-722-7112. Gracias.
Thank you, Armando. We are open for questions.
Just a reminder that we have limited time during these briefings, so only one representative per media outlet permitted, and reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. And for those logged in today, please use the raise your hand feature. And first up today is Jeff Cole of Fox 29.
Yeah, good afternoon. A question again for Dr. Farley. Dr. Farley, can you give us your assessment of the stresses that the city's hospital system are feeling at this point? And can you ballpark for us when you think the surge may be, in light of the fact there was reporting over the weekend that it's 2 weeks out, or at least in the ballpark of the 9th of April, if you could speak to that.
As far as the hospital's current status, there are a number of hospitals that have patients with coronavirus in the hospital. They are able to manage their care. The number of patients that they're seeing in the emergency departments is actually less than normal. So right now the hospital condition is good. We do expect the demand on the hospitals will increase over time, and they're preparing for that. As far as when the surge is likely to occur, there are many different models for this. I would not say we could say with any certainty that this is going to peak in 2 weeks. We certainly expect it's going to increase over the next 2 weeks, but I can't say when the peak will be.
Just to follow, if I could, Dr. Farley, do you think there will be a surge, or do you think that there's at least a chance that it might not be as severe as first feared?
You know, if you look at these models, the biggest unknown in all these models is how effective the social distancing we're doing right now is. If it is very effective, then it is entirely possible we will see a very, very slow increase in cases, and so it wouldn't be described as a surge at all. But no one really knows how to measure that. We want to continue to reinforce the messaging to make it be as strong as possible. And I don't want anybody to feel like we can drop our guard down and not prepare for the worst. We need to prepare for the worst. But we are hopeful that it'll be better than the worst. And if our social distancing is very effective, we may not see a surge at all.
Thank you.
Okay, thanks, Jeff. And next up is Sean Walsh of the Inquirer.
Thanks. One question is, how many cops have tested positive for coronavirus, and is it mandatory for cops who come in contact with someone who is positive to get tested?
I believe you asked how many cops, meaning police officers, have tested positive. As we've said, we're not going to confirm specific numbers of any specific employee. We have confirmed that there are police officers who have tested positive. It is not policy for us to test anyone who has been come in contact with someone, but it is policy to quarantine those individuals if appropriate personal protective equipment wasn't donned at the time.
Thanks. On the donation from the Sixers owners, could you, how much was the donation, and what is the breakdown between how much went to Phil Abundance and how much went to the school district?
I'm not sure about the Phil Abundance number, but we get back to you on the Chromebook number. It was substantial, 6 figures, and I'll get the breakdown for you sometime today.
Thanks very much. With the Leacourse Center, Dr. Farley, could you be more specific about the current hospital capacity? And this is similar to what you were saying about when the surge would be, but is there a time in your mind for when you think that it will be necessary to use the Leacourse Center? Like a week from now or a month from now?
You know, we hope that we never need the Leacourse Center at all. That is there in case the hospitals can't handle the demand. And as I said, the timing is very uncertain here in addition to how high the peak could be. We expect things will get worse over the next 2 weeks. It could turn around at that point, or it could continue to get worse for several weeks after that at that point.
And for the nurses and doctors there, how big is the staff needed to operate the site if it is needed? And where does the staffing come from? Who are the employees?
The equipment has just arrived, and we're now putting together a staffing plan for it, so we don't have specific numbers on that now. We want to have enough staff to be able to safely operate that for whatever patients it handles.
And where would...
Hey, Sean.
Yeah, you gotta
Yeah, Sean.
shut him down.
We're trying to move on. Okay, hopefully we'll get to a second round. We have more than 30 reporters logged in, and I know everybody has a lot of questions. We'll try to get to as many as we can. So next up is Pat Loeb of KYW.
Hi, the food distribution center at Overbrook ran out of boxes in a half an hour. We heard from a listener that there was another site that ran out very quickly. I don't know if this is general throughout all the sites, but do you have concerns about being able to meet the demand for food now that you've opened up these distribution centers?
I think that's why we're doubling the number of food distribution and meals that we hope to provide this week. I do think that the fact that we are running out just speaks to the need. We certainly are going to do everything we can to meet that need.
Okay, and my other question was, are you planning to close more roads to cars to give pedestrians more recreational area to social distance in?
We're certainly aware of a petition asking us to do that. We are reviewing the matter right now, but we do have some significant concerns about the resources needed to close roads, keep pedestrians safe, and whether our officers are better deployed elsewhere. But we are currently reviewing that now.
Thank you.
All right, thanks, Pat.
Next up, let me say, Mike, hold on. And just let me say one thing. Although we understand the need to exercise and that kind of stuff, the more people that stay home, the less likely this is to spike. And if you can stay home, stay home. And I don't want to backtrack on, we're closing streets and opening trails. I mean, that's fine. But the more you can stay home, the better you're serving your fellow Philadelphian.
Thank you. And next up, we go to Andy Metzger, freelancer.
I still muted?
I'm sorry, go ahead.
Okay, thank you for doing this remotely. Mr. Mayor, who are your point of contacts within the federal government for putting to use the economic rescue law? And how would the city, what are your ideas for how the city would spend what looks to be north of $500 million in cash that the feds will be giving you?
So we have our lobbyists working with our federal contacts and a team of managing director's office employees, finance, and chief administrative officer to really understand the stimulus package, understand the CARES Act, what exactly we can pull down for Philadelphia. But we are working with our lobbyists in Washington to be able to make sure we have appropriate access right now.
And any federal agencies in particular?
Again, we're working through our lobbyists to access those federal agencies and make sure we understand the CARES Act to bring as much resources to Philadelphia as possible.
Okay. And where do things stand with the partnership that last week you said there was some imminent announcement for a partnership with a local manufacturer about manufacturing PPE?
So we do have a partnership with one manufacturer, and I do not have the company's name off the cuff, where we have purchased cloth masks. Those are not your N95 masks, and they're not even surgical masks, but they do provide some protection. And I believe we've ordered 10,000 of those masks at this point. We may order more down the line. We can certainly get you the manufacturer's name.
Gotcha. And then lastly, this would probably be a question for the mayor, but President Trump yesterday suggested that one reason for the incredible demand on personal protective equipment is that some masks might be, quote, going out the back door. Is anything like that happening in Philadelphia?
I have no idea what he's talking about.
Okay.
All right, thank you, Andy. Next up is Martin Pratt of YBN Philly.
Thank you for doing this remotely. One question for the doctor. You had mentioned real quickly about the slight surge in the African-American community. Can you go into a little more depth?
I'm sorry, I didn't hear the question. Could you say it again?
You mentioned there was a slight surge in the African American community, or uptick, I think was the word you used. Could you go into a little more depth?
Yeah, I want to just emphasize that, so 85% of the laboratory results we get do not have information on race. So we don't have accurate numbers on race. And so I don't want anybody to get hung up on the numbers. What I do want people to focus on is the fact that this virus is spreading in every community in the city, in every racial group, every neighborhood. And so nobody should think that they're somehow protected from this.
Well, to follow up on that, Bloomberg and also New York Times last week released, Bloomberg on Sunday and the New York Times on Friday released county numbers. And we look at the county numbers where the underrepresented community is at, or communities of color, we're seeing nationally an uptick across the board in cities like New Orleans, Detroit, and in my community in West Philadelphia, to the mayor's point, on Saturday and Friday at Clark Park, there were tons of people outside playing basketball. So I hear what you're saying, Doc. I'm concerned about my community not taking this seriously. And so can you give me something that I can take back to the community that explains, look, you guys, we're not taking it seriously, and it needs to be taken seriously?
Well, I'm not sure what to say other than what I said before, that this affects everybody, and it's certainly going to be in every neighborhood. That's the reason why I raised this. And so we don't think people should be out playing basketball. This means that they're coming in contact with each other. They're risking themselves. They're risking their friends. They're risking their family. So everyone needs to take this very seriously. I should also add that, the first wave of this epidemic in Philadelphia tended to be in people who traveled other places, like people who went to conferences in Italy or that sort of thing. And then you saw the healthcare workers that they were exposed to. But now this is clearly circulating within the city of Philadelphia. So your average Philadelphian, who may never leave outside the city, is at much more risk now than they were, say, 3 weeks ago. And so people, just your average person in the city of Philadelphia needs to take this very seriously.
All right, thank you. Next up, Martin, I think we unfortunately have limited time and many reporters with questions. We'll try to get back to you in the next round. Next up is Annie McCormick of 6ABC.
Mike, can you move on?
You bet. How about Wendy Saltzman of NBC 10?
Hi, so one of the questions that I had was I had heard that a lot of patients are coming down from other areas to our area hospitals. Are we seeing that here in Philadelphia?
I have heard that there's some patients that are coming down, such as women delivering babies, but I have not heard that to be a large number of patients and that has become a problem yet.
Because you had mentioned when you were talking about the number of patients in the hospital that was just, a number of patients, but probably the minimum number of patients.
Correct.
So are we seeing COVID patients from other areas being taken care of in our hospitals?
I imagine there are some. I don't think that it's a very large number. We have in the city of Philadelphia about 6,000 hospital beds. So if we're talking about 70 patients or 100 patients, 200 patients, that's a very tiny fraction of the beds we have total.
Is there any concern about that?
We're concerned about our healthcare system overall, and our healthcare system has to prepare for it. At the moment, they're doing fine.
Okay, and then for the mayor, when we're talking about the money for the city funds, are city funds running out when you're saying now you're only going to be providing the $5,000 grants, or what's going on with that change?
No, we just had to limit the application process so we can get moving to get the money to people. We're not running out of funds. We're in good shape so far, and hopefully the reimbursement level will be substantial that we can replenish what we're spending. Again, $85 million was appropriated to take care of the initial issues, and we'll draw down as we need, but we're not in danger of running out of money at this point.
Okay, great. Thanks so much.
All right, thank you, Wendy. Let's try Annie one more time. Annie McCormick of 6ABC. No. How about Michaela Weinberg, again, of Billy Penn? Michaela, are you there?
Hey, can you guys hear me?
Yes.
Awesome. Okay, I have a couple questions, probably both for Brian. I'm wondering if you guys are considering developing field hospital space. I know New York now is putting some beds and tents in Central Park. Is that on your mind at all?
At this point, we think we have enough interior space. If we need additional space, we have a couple of options beyond the liquor center, but we're not at that point yet.
Okay. And so as Martin was talking about earlier, we've been hearing and seeing some people still doing group activities in Philly parks, like playing basketball. I'm wondering if you've considered taking down basketball hoops or any other recreational activities to sort of discourage hanging out like that?
So we actually started to take down some rims last week in hotspot areas. That's continuing this week. So you're going to continue to see rims come down across the park system.
Got it. Any insight on where they're being taken down so far?
I do not know off the top. I know we were looking at a site in Southwest Philly last week, and I know we were responding to complaints as they arose. We were taking a much more proactive and organized approach this week.
Got it. Thank you.
Okay, thank you. And next up is Jack Tomzik of Metro.
Yes. Hello. Last week there was a lot of talk about the quarantine sites. I was wondering if the city has signed any new leases aside from the Holiday Inn and the Lake Coors Center for any additional quarantine sites.
We have not signed additional leases. We are still in negotiations with some property owners, but hopefully in the next day or so, we'll have additional leases signed.
Okay, and one more question about the small business program. So why are you still taking applications for the $5,000 micro grants?
My understanding is that we still have some capacity in the micro grant program, and there's limited capacity in the loan program, and we're doing our best to continue to provide what support to our businesses as we can.
Thank you.
All right, thanks, Jack. Next up is Marco Serino of PLS Reporter.
Good afternoon, thank you. I did want to ask about one of the situations we're hearing from the State Department of Corrections and their inability or refusal to give out how many ventilators they have. I just wanted to see what the situation was in Philadelphia for local usage, if how many ventilators are available, and if there are requests to get more.
I'm not sure, Marco, we understand the question. Are you talking about how many ventilators are available in our jail system, or are you talking about citywide, or what specifically are you trying to get to?
I guess specifically for the jails, and also if you have a citywide number, that'd be good too.
Sure. So I can't get you the specifics on the number of ventilators available within the prison itself. Frankly, if someone needed a ventilator system, they would actually be transferred to one of our hospitals, which is any of our acute care needs are actually taken care of by a local hospital, not taken care of behind the walls. And I don't know if Dr. Farley wants to address incubators across the city or not. Ventilators, I'm sorry.
No, the hospitals have reported some data to the State Health Department on how many ventilators they have, and for the Philadelphia region, so not just the city, but the Philadelphia region, it's about 1,800 ventilators. That's a minimum. There may be additional ones that will be reported later. And so we're certainly keeping an eye on that, and also looking at other things we can do in case we exceed that.
Marco, are you good? I guess he's good. All right, next up is Jake Bloomgard of WHYY.
Hi, all. So we noticed that that there's a kind of higher number of positive cases as a proportion of the number of tests. It looks like more than 1/4 of the tests were positive. I was wondering if Dr. Farley could comment on that. Is it the result of fewer tests or more pointed testing, or what?
Yeah, if you're looking at the data that just for today, there was a problem with the data feed from some of the big laboratories, and we spent time cleaning the data for the positives, but we haven't cleaned the data for the negatives. So there's an underreport in the total number of negatives that came in. So look at that tomorrow, and that should be a little clearer.
Okay. Are you guys still doing contact tracing for the confirmed cases?
We are interviewing cases and trying to identify contacts, but we don't have the manpower, given these numbers of over 1,100 people, or close to 1,100 people at this point. We don't have the manpower to speak to each individual contact.
Okay. And how many people are being monitored in their homes? So.
I don't have an answer to that. For the most part, though, these people are going to be quarantining on their own. Again, we don't have the manpower to be able to keep in contact with everybody who's a contact during their 14-day quarantine period. That's, in part, the reason why we have these larger social distancing strategies here, so that everybody is, in a sense, in semi-quarantine.
Got it. Okay, thank you.
Thanks, Jake. And next up is Claudia Lauer of the Associated Press.
Hey, I'm sorry to bother you guys with this, but was wondering, I know last week you guys had said you were trying to get additional refrigerated trailers for morgue space if it were needed. I was wondering if you had gotten those or had signed a contract to get those.
We do have additional freezer trailer or refrigerator trailers on their way to Philadelphia. I just want to make it really clear so there's no misunderstandings. This isn't because we expect a large influx of people succumbing to the illness, but rather that it's likely that there will be fewer funerals, which will cause backups in both our city morgue as well as the hospital morgues. And so I just want to make sure that that is the appropriate context is around that resource request.
Got it. Can you just say how many you have coming or what the capacity increase will be?
I can't speak to the capacity increase at this point. We're also looking at other facilities in the city as well.
Got it. Thank you so much.
Mm-hmm.
All right, thanks, Claudia. And next up, let's go back to Martin Pratt of YBN Philly.
One follow-up question about the hotspots regarding the basketball and taking things down. It looked like the map that was used last week, I think the Inquirer put it up, just showed the hotspots like my zip code, 19143. Are you guys thinking about looking at that map and using that to decide where you're going to go to kind of create these areas where people can definitely still do health walks, but just discourage social interaction?
Yeah, we want to have people be social distancing in the entire city. The number of tests is not so great in any individual zip code that I would make much of the differences between the positivity rate in one zip code versus another. The key message of that is that the virus is everywhere. Everybody needs to take it seriously.
All right, Martin, you're good. We will go now to Denise. Denise, sorry for skipping you in the first round, but you're up.
Okay, I have two questions. One, the federal government announced that they were going to expand their stay at home until April 30th. Have discussions started regarding that for the city, or have you heard gotten any guidance from the state regarding that?
Our stay-at-home order doesn't have a deadline. If we need to.
Okay. Okay. And two, the contracts that were renegotiated, the one with the police in particular, and the other ones, what is the status of the other groups? Are you like far along? Is it is there like some little things you're trying to work out for an extension?
Okay, so from that standpoint, looking at your thesis statement, you guys.
I know. Sorry, Denise. There's some background noise as well. It comes through almost as clear as you. I think, in short, and I'll turn it over to the mayor. We are still in negotiations with the other unions.
Denise, you need to make sure, please, that any sounds you have going on your computer are muted. Thank you.
We're just
Mayor?
working hard with our other three bargaining units to get a deal so we can concentrate on their services that are necessary for us to get through this, as opposed to sitting down and negotiating, at length with our unions. We'd like to extend the contract for a year, appropriate raises that we can afford to get people focused on the job at hand as opposed to worrying about their labor contract.
All right, thank you, and thanks, Denise. So let's try again. Annie McCormick, we'll give you one more shot here. Annie?
Can you hear me?
Yes,
Yeah.
go ahead.
Okay, sorry about that. So the CDC issued a travel advisory yesterday to New York, New Jersey, and Connecticut, telling them to refrain from non-essential domestic travel. Is there going to be a point where if those people are from those states are coming here to Philly, that there's going to be any type of enforcement for them? Any type of checking at, like, say, 30th Street, bus depots, telling people to self-quarantine for 14 days?
So if I understand the question correctly, is it's about some sort of enforcement about preventing New Yorkers coming to Philadelphia. So we have recommended and requested that people coming from the New York City area stay in quarantine for 14 days after they arrive in Philadelphia to reduce the risk of spread to others. But trying to prevent them from coming here doesn't make sense epidemiologically. If you look at models, it's not going to make much difference when the virus is already widespread in the city of Philadelphia, and it's virtually impossible to enforce. People can drive through many different channels. So no, we're going to stick with our recommendations, people quarantine, and ask for cooperation on that.
And just to follow up real quick, is there any idea that you might actually try to enforce to stop people from arriving, or check with people, that, checking temperatures, anything of that nature when they arrive at 30th Street or bus depots? Any, that you might try to be enforcing to make sure that people do self-quarantine when they come off of buses or from the state?
I mean, we're not gonna be like some states and pull over people without New York tags, nor are we gonna set up a checkpoint at the state line or at any of our bridges to double check to see if folks are feeling ill. I think the doctor described that the epidemiological impacts of folks coming in from out of state are slim. And I also think, let's not look at this as just a Pennsylvania or a Philadelphia issue. This is a countrywide issue, and we need a countrywide response. And while our system makes that somewhat difficult, it doesn't change the fact that we as Americans are in this together, and we as Americans have to stand together in order to get through it.
Annie, are you good?
I'm good, thank you.
All right. Let's go now for a second round to Sean Walsh of the Inquirer. Sean, are you there?
Yes, can you hear me?
Yep, go ahead.
Great, thanks. The time and a half agreement that the administration negotiated with the unions has expired. Are you guys considering recreating that for some essential city workers?
No, the time and a half has ended, and we're trying to negotiate a contract with reasonable raises to cover that.
Okay, gotcha. And what's the logic for not doing the time and a half anymore?
It's very expensive, and we believe, and currently the FOP agrees, that the 2.5% that they received, 2.5% that they received is sufficient for them, and it will in the end save us money too.
Gotcha. Thanks very much. That was the only follow-up I had. Appreciate it.
Great. Thank you, Sean. And Laura Benshaw for WHYY.
Hey, can you hear me?
Yes.
Well, two quick questions. Thank you for your time. The first is the city considering implementing safety measures in the jails similar to what the State Department of Corrections announced today? Things like feeding inmates in their cells and limiting time outside of cells?
So we've taken a number of precautions within our jails. We are not considering restricted movement throughout our system at this point. We've had limited cases within our jails. Certainly, if things progress, we will certainly make adjustments. But right now feel comfortable with the protocols we have in place, and then those protocols will be published online in the next day or so.
Okay, thank you. And the last question is, parties, big gatherings, have y'all had to break any of them up? We know in New Jersey, weddings are getting shut down because people are flouting prohibitions against gathering in groups.
I'm not aware of any time where the police have had to come in and break up a party. Certainly, we have had conversations with Airbnb to discourage their users and make it very clear what our expectations are across the city. But I think for the most part, Philadelphians have listened and are behaving appropriately to make sure that they keep themselves, their loved ones, their families, and the rest of the community safe.
Thank you.
Thanks, Laura. Now let's go to Brian Mendoza of NBC 10 Telemundo.
Hola, muy buenas tardes. No sé si le puedo hacer la pregunta a Armando para ver si él puede traducir. ¿Me pueden escuchar?
Sí, sí le puedo escuchar. ¿Cuál es la pregunta?
Hace unas horas hablamos con un doctor del hospital de la Universidad Temple. Él nos está diciendo que entre el 60 y 70% de sus pacientes que tienen coronavirus son de habla hispana y no pueden entender inglés. Tienen que usar FaceTime con su familia para que ellos le puedan traducir las preguntas. ¿Hay algo que la ciudad está haciendo para que, se pueda ayudar a la comunidad hispana más? Porque a nosotros también nos están diciendo que no entienden la información que a veces pone. Nosotros estamos tratando lo mejor que podemos con estas conferencias de prensa en español, pero todavía vemos que hay una alza, o el hospital Temple más que sea tiene un alto porcentaje de hispanos contagiados con coronavirus.
Le repito su pregunta. Usted dice que ha tenido un contacto hace unas horas del hospital de Temple que le ha dicho que el 85% de los pacientes con el coronavirus no tienen medios para poder acceder a información con traducción y que tienen que apoyarse en sus parientes a través de FaceTime para poder comunicarse. Y la pregunta es si la ciudad tiene algo planeado para poder dar acceso lingüístico a estos pacientes. ¿Es esa su pregunta?
Sí, y es entre 60 a 70%.
60 a 70%. Un momento, por favor. So the gentleman has a contact from Temple University system that says that 60 to 70% of the patients that have been seen with coronavirus are not English speakers, and they have a hard time getting information out to them, that they have to rely on their relatives through FaceTime to do translation. And the question itself is if the city has anything in place to help hospitals, and specifically Temple, to address this linguistic breach.
We will, I hear the request. I'll have to bring it up with Temple. We'll be happy to bring it up with them.
Vamos a reunirnos y vamos a solicitar una reunión con Temple para ver este problema.
Listo. En cuanto al distanciamiento social que se tiene en pie, la orden de quedarse en casa, todavía yo a veces veo mucha gente, especialmente cuando sale el sol y el tiempo está agradable afuera, hay mucha gente congregándose. La ciudad está viendo esto y está pensando en tal vez poner prácticas o aplicar leyes, sanciones para que esto no ocurra aquí en la ciudad, para que el virus se siga propagando, para evitar eso.
Te repito tu pregunta, Brian. Estás diciendo con respecto al distanciamiento social de que hay información anecdótica de que la gente se está congregando, y tu pregunta es si la ciudad tiene alguna práctica que quiera implementar, alguna ley, alguna sanción para impedir de que la gente se congregue mientras se dé esta crisis. ¿Es esa tu pregunta?
Correcto.
There's anecdotal information that people, especially after work hours, are gathering up and are engaged in social activities, and they're disregarding social distancing. The question is whether the city has any practice in place and is contemplating any laws or sanctions for people that are doing that.
Any knowledge of large groups should be called to 911, and police will respond appropriately. But we are going to discourage and not incarcerate for large gatherings.
Cualquier conocimiento que se tenga de reuniones de grupos grandes debe reportársele al 911 responsablemente y vamos a responder. Pero en estos momentos lo único que vamos a hacer es desalentar las reuniones y los grupos. No pensamos encarcelar a nadie por el momento.
La última pregunta es, ¿se tiene en mente algún otro lugar? Sabemos que Hahnemann está fuera de la lista para un tipo de espacio de aislamiento social para personas o tratar a personas con coronavirus con síntomas leves, pero ¿hay algún otro espacio o edificio que se está hablando para tener este tipo de lugar para los pacientes?
Nuevamente, Brian, para resumir tu pregunta, ¿tienes conocimiento que en otros lugares se está aislando a la gente en un espacio por separado? Y tu pregunta es si hay alguna conversación o se está contemplando tener esos espacios en Filadelfia. ¿Es esa tu pregunta?
No, necesariamente no. Es si están en habla o en plática con algún otro tipo de edificio para contratar el espacio y poner camas disponibles para pacientes con coronavirus.
Si se está contemplando tener un espacio específico para alojar a la gente con coronavirus.
Sí. Si se tiene algún otro edificio en mente planeado, se está hablando de un contrato para algún tipo de espacio para aislar a pacientes de coronavirus.
Fuera del de Hahnemann, dices tú.
Sí, claro, porque el Hahnemann ya sé que el contrato ya se finalizó.
Bien, gracias. In light of the failure of Hahnemann to be used as a space to house people affected by coronavirus, is there any thinking or any conversations in place to have such a space into the future, to have isolation space for people affected by coronavirus?
We're in a number of conversations with property owners for both quarantine and isolation space, and hopefully we'll have additional leases in the near future.
Estamos teniendo una serie de conversaciones con propietarios de espacios que pudieran utilizarse para tener espacios de aislamiento o de cuarentena y vamos a informarles según estas conversaciones progresen. Gracias.
Gracias, hermano.
All right, very good. And we have just 1 or 2 minutes for last question. Let's go to Denise.
Yes, thanks for coming back to me. It was mentioned that the prison population, if you need a ventilator, would probably have to leave the site. But prisons do have infirmaries. Have they been given any special guidance on what to do with inmates that test positive or even guards that test positive for the coronavirus?
Yes, the prisons has a very specific protocol for both inmates who show symptoms, who would then be quarantined at a separate facility, as well as those who test positive, and certainly quarantine protocols in place for anyone who had contact with those inmates, as well as potentially staff, correctional officers, or other staff on site.
All right. Denise, you good?
I'm good.
All right.
Thanks.
Thank you, everybody, and that concludes today's daily briefing.